Hi everybody. I'm going to wait a little bit, see who's going to show up today. Thank you for joining me in my AMAP Friday Ask Me Anything Pilates. So there's a couple questions today. One of the questions is working with somebody who has had a kidney transplant. So I'm going to be discussing some of that. I'm not going to get into like deep detail and all that stuff, but I'll go over the basics for you. And then there were some questions about Joe's heritage and some other things. So I'll get into that. Hi, Alexandra. Hello, Hang Yuan. I'm not sure if I'm Hang Yuan from Vietnam. Nice to see you. I went to Vietnam in 1995. Studied some acupuncture at the Traditional Medicine Institute in Ho Chi Minh. So there you go. Little connection there. All right, so let's see. I'll give another minute or two. Yes, 1995 I went. Long time ago. Cordelia, I think. Hi, Cordelia. Nice to see you here. Just gonna say hello to a few more people. You're from Hanoi. Okay. Well, I didn't make it to Hanoi. I was there studying, so I just basically was in Ho Chi Minh most of the time. Went to a couple places not too, an hour or two away from Ho Chi Minh. That was about it. So, yep, north. I know the difference. I do know. So, sometime maybe I'll go back. We'll see. All right. So today, the one question I had was working with somebody with kidney transplant. And, how would I address that and approach that? Hi, Sil, from France. Nice to see you. So the way one of the things that you have to first understand is, okay, it's a surgery and it's a transplant, so how does that happen? And basically, as far as I know, what happens is that when they do the surgery, it's the kidney is placed in the belly in the front. And quite often the kidney or the two kidneys that were bad, because usually if you get a kidney transplant, you don't have one that's any good anymore. Because as long as you have one, you can keep going. So usually both kidneys are bad, and you don't usually remove those. They just put another one in, because if they put it in the front of the belly, it's closer to the bladder, and there's also some blood vessels that they can attach it to that are there that are more easier to do that with. So that's what happens. So that really is going to affect and inform how you have to do your work, right? Because there's a couple issues there, right? If it's in the belly, right, well, what are we always trying to do, right? We're always trying to contract the powerhouse, and some people want to do it very strongly. And if you're going to roll, well, like swan dive and things like that, you really probably shouldn't be doing that because it may not be a problem, but you don't want to take that chance, because they've already had a surgery for a transplant, and getting a kidney transplant isn't always easy, right? It's not always something that you can just get. You go, oh, I need a new kidney, and you get one. There's a waiting list, at least here in the U.S. I don't know about in other countries, but here in the U.S. there's a waiting list. You got to wait sometimes a long time, and you're on dialysis and all these other things, because they can filter a lot of the stuff out of your system that way, but then you're attached to a machine, and that when you get the kidney transplant, it allows you to avoid that. So I would tend to be very careful, and I would not do any belly rolling exercises. I guess you could always talk to the physician and see. Me personally, I wouldn't want to take that chance, because I just wouldn't want something like that. You're rolling around on the kidney, and it's not physiological. It's not normal. So is it in the way? Can you damage it? Can you create problems? And that's a possibility. So you're going to have to modify your workout to a certain degree. But luckily with Mr. Pilates, he did such a broad base of exercises that there's still so much you can do even though you can't roll on your belly necessarily, and you have to be careful with your, your powerhouse contractions and how you're going to do that, right? So, I mean, one of the things that you can do a lot of, is anything that's lying on the back, you should be able to do fine. Anything that's kneeling or sitting, maybe stomach massage, you have to be a little careful, right? So there's some things that you may have to modify, but you could gear out the stomach massage and you could sit back and still get some of the benefit for the coordination of the exercise for full function with a modified version, right? So that's definitely something that you would be able to do to make that happen. So something to think about there. And then, you have the leg springs, right, that you can do, and you have all the arm springs. Joe had a lot of arm springs. Pilates increases if you contract your, everybody take a deep breath and exhale easy. Now push all the air out of your lungs. When you push all the air out of your lungs, what are you doing? You're increasing the inter-abdominal pressure. So that happens, naturally to a certain degree if you're doing deep breathing, of any type, you're going to do that. And basically, what you have to think about is that you have, diaphragms, right? You have the pelvic floor diaphragm, and you have the upper diaphragm, which is what you're going to use for breathing, right? The diaphragm muscle contracts down in that, but you also have the pelvic floor, and they both. And when this one contracts, the bottom has to contract, right? There's always this constant back and forth, because if you contracted the diaphragm, the breathing diaphragm muscle, what would happen if you didn't contract the pelvic floor? Everything would go out the bottom. And, sometimes you'll see that in much more often in women than men because of their anatomy, but also if they have given childbirth, a lot of times that's been, that area has been, if it's been natural childbirth and not a cesarean, that has been stretched, and sometimes some of the nerve and other things have been slightly damaged or become dysfunctional because of disuse, because of pain and other things. That's a whole nother webinar or AMAP or question. But anyways, so back to the kidney. So what you can do with the arm springs, and if you start to do the arm springs, and a lot of the other exercises, there's standing work you do on the chairs, right? There's sitting work on the chairs. There's other things you can do on the Cadillac. So there's a lot of exercises that you can do, right? And the difference is, since you have to leave some, a fair amount of those out, you have to be careful. Even, some of the rolling on the back exercises, you might want to be careful of because they have to do a lot of contraction in the lower powerhouse. And again, I think that the best thing to do is to talk to the surgeon, their doctor, and show them the exercises and let them say no. Because, does the doctor really, know what you're teaching? Because, and take no offense, in today's, anything goes Pilates, there's lots of exercises that Mr. Pilates didn't teach, and it might, and I don't know, I don't look at all that stuff. I just focus on what Mr. Pilates taught. And so for those, I would then show, the doctor those exercises and say, are these okay? If you're doing some sort of other contemporary or whatever, you're doing, whatever your exercise you're doing, and if it's called Pilates, have the doctor check it out and see, especially if it's going to be on the rolling on the stomach for sure. I think they would say no, but I haven't asked that from the doctors. I've worked on a number of kidney transplants as patients as a physical therapist, but I didn't have them working with Pilates at the time. So because it was more on Broadway shows and other things, so it wasn't as intensive, right? And they had been, had those issues for, they'd had the transplant years ago. And again, so if it's a new transplant, you definitely have to follow all the protocols that the doctor sets up for the client or the patient. That what you can and cannot do after the surgery, and how long before you can do certain things, and all that type of stuff, because that's very important. So things to think about, right? So that's sort of, without getting into specifics, because, if you have somebody that has that kind of condition, I'm not a big fan of trying to evaluate and give suggestions on what to do without seeing somebody and really knowing what their issues are and having their history, because the history is very important. So I don't do that on social media. I can give you basics and fundamentals, which is, you know, what's the surgery, where is it, which we've done, right? You know, it's in the belly, so, you know, I would say don't roll on your belly. And then anything with the powerhouse that you have to contract, any rolling on your back or some other things you might have to be careful of, check with the doctor. But use all the other apparatus that you can use, and you can develop a program. And it doesn't, you know, it's like I always say, you know, you have to find the best balance within the imbalance, right? And everybody has an imbalance. So what's your goal? You know, what are you trying to do for that person? What are their needs? And, you know, sometimes you can't do everything that, you know, you need to do, that you would want to do in a classical workout, because they have a body issue that won't allow you for that. So, hey, Mary. So you can't necessarily do a traditional classical or archival workout, right? And again, or maybe more likely than not, even a contemporary, right? You know, not really, you know, again, it depends on what you're teaching. So that being said, you know, talk to the doctor, talk to the client, start to develop, work on the things that you can do that don't put any stress or strain, and then progress it as you go. And, you know, you can progress and still get somebody intermediate to advanced with all of that stuff pretty much, right? You know, for their particular body and their particular needs. So that's what I would suggest for that. So there was a couple other questions, you know, that somebody had sent me. And again, so if you have questions about anything, right, it can be biomechanics, it can be ergonomics, it can be exercises, it can be history. Oh no, not history, because Elaine and I do history in a different Instagram. But you know, if you have business, I've run Pilates studios for over 30 some years. I just, you know, I closed mine because of the pandemic, but I still have the studio up in the Berkshires. So, you know, I've been running a Pilates studio since 1990, so a long time as well. So, if you have any questions, DM me and I will add them to the list. So, one of the questions was Mr. Pilates German or Jewish? And can't you be? That was the question, and my question is, well, can't you be German and still Jewish? I mean, maybe they were asking if they were, you know, German or Israeli, but I mean, to me, you can, you know, if you're born in your country, I pretty much consider that that's, you know, I'm an American. My heritage is German and Irish, and maybe some other. I haven't done one of those DNA tests, so I don't know for sure if there's other. And there probably is, because most people do have that, especially in America, where, you know, we're the land of the mutts, right? We're very interracial and interchangeable as far as you know, our heritage goes. So, but you know, Joe was born in Germany, so he was German. His father may have been from Greece, possibly. And his mother was German, I'm pretty sure. I mean, you know, I'd have to go reread Kathy Strack's book on Getting to Know Joe. I'm pretty sure that's all in there, and if you haven't read her book, you should. And it'll answer a lot of the questions you may want to ask, especially about history. So that would be something I would suggest you do as well. As far as Jewish, I don't believe so. I don't see any reference in the archives of him being Jewish that I know of. Again, but I don't know for sure. And you know, somebody asked about him going to England. You know, was he fleeing Germany? But you have to remember that when Joe went to England, it was before the First World War, so and the Second World War. So you know, a lot of the stuff that people left Germany for, you know, before the First World War was for work, because there wasn't always enough work in different places. In other countries that were booming, you know, that's where people wanted to go, and you didn't have as many of the restrictions you have today as far as immigration goes in the countries. It was a lot easier to travel between the countries in Europe. I mean, that's kind of open now but like, you know, you have Brexit, and so now you have England no longer open to, you know, the free flow of people, where in the rest of Europe you still do, right? So I think that's, you know, a difference as well. So that was one of the other questions. So I don't believe he was Jewish, and I believe you can be German and Jewish at the same time. And he went to, and I'm not so sure he went with his brother, because I'm pretty sure his brother was a soldier in the First World War. And when he was at the Isle of Man, he was interned there because of his German citizenship, right? That's why he was there. What England did, if you were German, they put you in a camp, so that, because they didn't trust you, basically. And you know, the U.S., they did the same thing with the Japanese in California. They put them in camps. You know, they were not, you know, I guess you could, they were prisoners, right? Because they weren't allowed to leave, and they weren't criminals per se, because, you know, maybe there were some there, I don't know, but they weren't put there because like we have jails now. People, you know, if you break the law, you get put in there. They were put there because of their German citizenship, or their, you know, because they were German. So did Pilates know calisthenics? Well, you know, yes, because why? If you look at the history of exercise, calisthenics was basically the exercise that didn't use apparatus, and it was, you know, at the time when it was first developed, you know, it was more for women than it was for men. Okay, and you know, so there was definitely you know, I'm sure, and in Germany, you know, when you look at the history of the exercises in like German gymnastics or Swedish gymnastics, you know, they were competing methods in Joe's day. The Germans started at the, you know, the early 1800s, and so by the time Joe was born in 1883, it was integrated into the schools as physical education, and his father was also a practitioner of gymnastics. So more likely than not, you know, he was exposed to it, and it was something that was taught, because it was taught. If you look, there's, you know, there were books written and about calisthenics in Germany, and that's where part of that came from. So I have a webinar that I do called The History of Exercise, you know, before Joe. So I do the history of exercise from 1945 backwards, because, you know, he published his Return to Life with exercises, right? I mean, Your Health didn't really have exercise, it was more philosophical. But, you know, Return to Life was the exercises. And so I look at that, and, you know, I've been collecting books on exercise for almost 40 years now. You know, when I first started, even before I started as a PT, when I was dancing, I got interested in exercise. So I have, you know, hundreds of books on exercise, and I can tell you that the majority of Joe's exercises are not new. There's variations, right? He did variations of what was already done, but not, and then he made up things as well for his apparatus. But you know, the body only moves so many ways, right? So there's only so many things that you can do with the body, and there's millions of combinations, but the basic foundational functions. And when we look at how Joe understood the body and how he trained himself to learn how to work with the body, that's even clearer, because, you know, there's a developmental organic way of learning movement that we all do, and that's what he based the system on. It's not based on a muscle or a muscle group or strengthening a muscle. It wasn't really about that so much. It was more about strengthening everything all the time, and all the muscles are always working. They're just working different ways. And he understood that, and he, you know, when you look at his exercises and how he did, that's something that he did. Okay? So, I think that's it. So again, if you guys, thanks for joining me, everybody who's joined. I didn't get to say hello to everybody, but if you're interested and you have questions that are specific, you know, and you'd like to answer, I'll do my best to answer that, you know, in the knowledge that I know, you know, as close to the actual factual as I can find out. And, you know, between the archives and my background in PT and other things, I should be able to provide you a way of understanding that. So just DM me, and every Friday, you know, when I get questions, I'll bring them on and we'll start talking about it. So, hi Helen. So if you have specifics, let me know. let me see, on every Tuesday at 12 o'clock, I teach a class. It's not Pilates, it's called Balanceology. And it's if you're having any balance issues, or you know anybody who has balance issues, and I teach it every Tuesday, and it's a half hour. And then after that, I do Joe's resistor poster workout, and it's arm springs and leg springs. You don't need the resistor to do it. If you did, it was great, but if you don't, you need, you can have a wall unit or a Cadillac, and you can join in and start learning the arm and leg springs. So that's another thing that we can do as well. Anterior train, when you start talking about, you're talking about things that are, that's a whole nother it's a whole nother process, because if you look at where it really starts, it starts in the nose, right? Because you have to look at the skeleton first. How do we develop? Before the muscles develop, you have the skeletal, right? And you have, and when we're looking at that, there's the cranial work, and the cranial bones are much more mobile than or the facial bones are much more mobile than the cranial bones. And then you go down the spine, and then you go out through the extremities, and then we look at the nerves, the arteries, and the fascia and the muscles, because that all connects everything together. And so, that's somebody's hypothesis. The anterior train starts at the tongue. And maybe, but not necessarily, because you have other muscles, all over. Okay, so, and does Joe deal with the facial muscles per se? No, not really. I mean, he makes faces, but he doesn't do facial muscles. There were books of exercises in his time where people focused on doing exercises for the face, for sure. So you have different people doing different things. There's lots of different ideologies and hypotheses out there about how things work and what they do, and if that works for you and it works for your clients, it's then great. As far as when you look at the anatomy, though, there's different ways of looking at that, because the osteopaths look at it one way, the Rolfers look at it a different way, massage looks at it a certain way, PT, orthopedics. Everybody has their their blinders on, and they look at certain things and they do things in their own way, and they have philosophies that are foundations, but they're hypotheses that very few of them have any real dynamic proof that that's really how it works or what happens, and they haven't done enough research, because doing research on movement is very difficult. If you have a pill and you have this pill, it's very easy to do that, but when you look at movement, because we move all the time, and so if you do an exercise workout for a half hour 3 times a week, well, what about all the other hours of the week that you're still moving, and what's the effect and what isn't the effect? So that creates there's so much more that needs to be addressed that way. So, but as far as, did Joe have face muscle exercises? Not that I have in the archives that I can see, but that doesn't mean that he didn't necessarily do something like that. We just don't have it. We had eye exercises, right? So you have eyes, right? So, and again, is the anterior chain, why isn't the muscles in the eye part of the anterior chain, right? It's not just the tongue. That comes here, but you have eyes, you have muscles here, you have muscles that go front, front and back. So where does it all, it's all the muscles. It's never one, specific, placement. And when you talk about anterior and posterior, you're breaking it down, and you're trying to go lower and lower. And Joe didn't do that. Joe looked at everything. He looked at all the things together. And when you breathe, you do certain things, and when you do, and he had singers sing. So did he do facial exercise? No. Did he do singing? Make you sing while you exercise? Sure, he did. We know that. That's something that he did do, and that's part of the tongue. But I work on Broadway, and I have a whole vocal, hands-on manual technique and system that I've developed. Because when I started working on Broadway, it was with just dancers. So I went there to work with dancers, but then I would have the singers come in and say, I'm having trouble. And basically, I would always say, if you go to your ENT and he says your vocal cords are fine and you're still having trouble, then I can help, because, there are over 70 muscles that, you use, basically, about 70. It might be a little less, but it's almost 70, that you use to sing, speak, talk. I mean, especially if you're belting and doing things like that. So it's never about the tongue, or and or there's TMJ muscles. There's muscles in your face. There's muscles in your throat. There's muscles in your throat that go to your shoulder blade, that go down to your sternum. There's all these different connections. And then there's the diaphragm and the relationship of the diaphragm with the ribs and all the accessory breathing muscles. So there's there's so much that is involved that I'm not one to look at a chain and say, well, we have to focus on this or we have to focus on that. We have to look at everything, and that's what Joe did. So that could be a question if you want. You want to get specifics. You can ask me DM me a specific question, and I'll try to do it. I mean, I think these derivations are always good because somebody has another question, I can go. But if you have specifics, DM me, and I will do my best to look at it and try to answer it, and we can go from there. All right. So I got to run. So thanks you all again for joining me, and I will see you hopefully sometime soon. All right. I think, is there anything else I need to tell you about? I think that's it for now. All right. So see you next week. Bye.